Hello, my name is Elizabeth Mason. I'm the Director for Recruitment and Selection at the School of Health Sciences at Bangor University. This short presentation is just to provide you with some information about our entry requirements for the Bachelor of Nursing and the Bachelor of Diagnostic Radiography programmes, and some information about our selection processes. The first thing to consider is, what are admissions tutors looking for? Well, to put it in a very rounded way, we're looking for people with motivation, and there's various aspects of motivation that we are looking for. We're looking for individuals with motivation to work with people. To work in the healthcare professions, you need to like working with people, you need to like being with people. So it's important that you want to work with people and you understand what that would mean as a healthcare professional. A lot of the things we do as healthcare professionals is to problem solve. So whether that's that sort of planning the care for a patient, whether it's to get a diagnosis of what's the matter with the patient and to diagnose their care needs, it's about problem solving. So it's about taking information, working out what the need is for that particular patient or client, and then be able to put together a plan of action that is person-centered, so the patient or client is involved in that planning and that suits their care needs. One of the most important things is the ability to develop really good communication skills, because as a healthcare professional, so as a nurse or a diagnostic radiographer, you need to be able to communicate effectively with patients. And some patients and clients may have some sort of communication deficits. They may be hard of hearing, they may have a speech impediment. So you have to be able to understand sort of the various communication needs for patients, but also what you need is really good communication to work as part of the healthcare team. So it's about passing on information, collating information, and being able to communicate effectively as part of that healthcare team. You need to be able to develop the clinical skills that are required either for your field of nursing or for diagnostic radiography. And certainly for nursing, we have what's known as a practice assessment document, and that is an all-Wales practice assessment document. And you use this during your practice placements to develop the clinical skills that are needed to be able to practice as a registered nurse in your field of practice. And the same for a diagnostic radiographer. You would have a number of core competencies that you would need to achieve within your practice learning. We need to have students who have the potential to be able to develop their ability to record and communicate effectively and accurately in the written form as well. There's also a professional requirement for numeracy and literacy. What we're looking for is people who have insight into the course that they're going to apply for. So do they know what a registered nurse does in their particular field of practice? Also, do they know what a diagnostic radiographer does? So it's important that you think about this and you do some research to find out what it is a registered nurse in adult, mental health, child or learning disability field does on a day-to-day basis. What does it mean to be a registered nurse in that field of practice? Why is it you need a degree, a 3-year degree, to be able to practice as a nurse rather than being a healthcare support worker? So it's important that you do some research, that you think about the kinds of day-to-day activities that a healthcare professional does. And the best place to look at that is on the NHS Careers website. There's lots of information there about the numerous careers that you can have in healthcare. So when you come to interview, you're able to articulate to the person doing your interview what you understand a nursing role or a diagnostic radiographer role to be. So the Bachelor of Nursing entry requirements, it's a typical offer of 112 UCAS points. And if you're thinking in A-levels, that would be BBC or BB and the Welsh Baccalaureate at a passed grade, so B or above. For nursing, we don't really specify particular topics that you need to have. But it would be useful to think about things like sociology, psychology, biology, physics, English or history. All of those allow you to develop the skills around writing, but also being able to research for evidence to support the points that you're making. If you're doing BTEC, then the BTEC Extended National Diploma, our typical offer is Distinction Merits, which is also 112 UCAS points. We have a number of students who undertake the Access to HE diploma. And again, the way in which the credits accrue to give you 112 UCAS points is slightly different, because you do units of learning that are awarded 3 credits, 6 credits, or even maybe 9 credits at distinction, merit, or a pass. So we're looking for a typical offer again of 112 UCAS points, but with a distinction and merit profile. Now, we understand that people who are returning to education, they may accrue some passes very early on. So what we would do is to look at your profile to see when you got your passes and to show how you've moved up to that distinction merit profile to achieve your 112 UCAS points or above. As I mentioned before, all of our applicants must have maths and English at GCSE grade C or above. We also accept the numeracy element of the Access to HE diploma and the communication element of the Access to HE diploma. We will also accept, as an alternative, a recognised alternative, the Essential Skills Wales Level 2 in numeracy and communication, instead of the English or Maths GCSE. We do look for care experience which is commensurate with age. Now, this doesn't actually have to be hands-on care experience, because what we're looking for are the qualities and values that you will need to be able to practice as a nurse or a diagnostic radiographer. So the kinds of things that we could be looking for in terms of care experience, particularly if you're in school, is things: have you been taking part in reading schemes? Have you acted as a prefect, peer support, a buddying system? Have you taken part in things like brownies, guides, supporting younger people in those kinds of activities? Or have you done, for example, the Duke of Edinburgh? Because that demonstrates to us a lot of the qualities and skills that we're looking for in a future nurse or a future diagnostic radiographer. Now, we would also think about your part-time work. Many of our applicants have worked part-time. And for example, if you have worked in, say, for example, a local supermarket or a restaurant, you're developing some of the core skills that we're looking for in our applicants. So that could be team working skills, the ability to think on your feet and having common sense. So essentially what we're looking for is somebody with the intellect to be able to undertake the degree, the common sense to be able to practice, and those qualities and values that are needed to work with people. We would call that intelligent kindness. And I think in preparing for an interview, I would very much make sure that you understand what those sort of 6 C's mean, but also about the concept of emotional intelligence and intelligent kindness. For our selection processes, all of our students, because you're going to be working with people, you need to be able to undertake the role. So we do occupational health screening. We also have to do the enhanced DBS screening. All of our applicants are shortlisted using the predicted grades that you provide on your UCAS statement and your personal statement. So it's very much important that you do actually think about your personal statements and relate it to the course that you want to apply for. We undertake a value-based interview process. So for nursing, that would be a group work activity, multiple mini interviews, and a short essay. We also have other formats for diagnostic radiography. So there will be a group talk and an individual interview with a member of our academic team and a member of the clinical team as well. Now, at the moment, we have had some restrictions because of COVID-19, but we are hoping that things will go back to normal as quickly as possible. But it is important that you do look on our website to make sure that you understand the way in which our interviews are going to be conducted at the particular time. Turning to diagnostic radiography, now they are responsible for producing the images, the X-rays, ultrasound, CT and MRI images that are used as part of diagnosing particular conditions. They're very much an important part of the healthcare team, and it is a clinical and academic course. In the same way as nursing, it is about the ability to develop the clinical competence and take the theory and apply it to your practice. Now, the typical offer for diagnostic radiography is 120 UCAS points. And they are looking for a science. So we do look for a science for diagnostic radiography, and that could be physics, chemistry, biology. For BTEC, that would be distinction, merit. For A-level, it would be 3 Bs, including one of the science topics. You do have to have your maths as well, because that's very much an important part of the application process. Now, successful completion of this programme leads to registration with the Health and Care Professions Council, whereas completion of our nursing programmes leads to registration with the Nursing and Midwifery Council. For both of these careers, you've only got to look at the NHS Careers website to see just what excellent career prospects there are for you. So you would start as a newly qualified person, a newly qualified member of the team, and you could undertake continual professional developments, and you can apply for different roles. Once you've developed your proficiency, you've done your preceptorship, and you know how to work as in that particular field of nursing practice or as a diagnostic radiographer. And from that point in, the careers are endless. So you can particularly for nursing, for radiography, then you can go on to do different kinds of radiography imaging. So for example, working with pregnant women and doing their sonography. Thank you for listening. Please do take a look at our websites for diagnostic radiography and our different fields of nursing. And we can answer any of your questions during our virtual open days. And there's also lots of information on our website. But also don't forget, have a look at NHS Careers, and you can see the kinds of careers and the progression that you can have if you undertake a course at Bangor University and qualify as a registered nurse or a registered diagnostic radiographer. Thank you.